Welcome back everyone to Meded. Just as I had mentioned earlier, this is your trusted channel for everything related to medication. My name is Ngoya Nicholas and I'm a pharmacy practitioner. I'm delighted that you've taken your time to watch this video once more. Okay, so today we are going to delve into another type of NSAIDs. This time round we are looking at the selective non-steroidal anti-inflammatory medication. Remember that we have been discussing about the non-selective ones. Okay, so we are going to delve into this type of NSAID by the name celecoxib. Okay, celecoxib is a selective NSAID, and we'll delve into much more about this type of NSAID deeper as we move forward. So just before I begin, allow me to raise this disclaimer. The information on this channel is basically for informational and educational purposes only. It is not meant to substitute your doctor's advice or prescription. Okay, so ensure you consult your healthcare provider before making any decision on your medication and your health. Okay, so back to our topic. So celecoxib. So what is it? Celecoxib is commonly known by its brand name Celebrex. It's an non-steroidal anti-inflammatory drug, also known as NSAID. It is specifically used to treat pain and inflammation associated with various conditions like arthritis, acute pain, and menstrual pain. So it was introduced in the late 1990s as celecoxib and was developed to provide effective pain relief with fewer gastrointestinal side effects compared to traditional NSAIDs. Okay, so this drug is especially useful for people with chronic inflammatory conditions like osteoarthritis, rheumatoid arthritis, offering them a way to manage their symptoms and maintain their quality of life. So celecoxib's unique mechanism allows it to stand out amongst other NSAIDs, making it a valuable option in pain management. So how does celecoxib work? Celecoxib is a COX-2 selective inhibitor. Remember, as we had discussed in other NSAID that we have spoken about in the previous videos, they are all the non-selective one, meaning they inhibit both the COX-1 and COX-2. And remember, the COX that is supposed to be inhibited here is COX-2, not COX-1. Okay, so but for Celebrex, it's a good medication because it is selective. It only inhibits COX-2, which is a dangerous COX, and leaves COX-1, which is a good COX. Okay, so let's delve deeper into this. So COX-2 or cyclooxygenase 2 is an enzyme responsible for the formation of prostanoids, including prostaglandin, which mediate inflammation and pain. So by selectively inhibiting COX-2, celecoxib reduces inflammation and pain without significantly affecting COX-1, which protects the stomach lining and regulates blood platelets. Okay, so COX-1 COX-1 main function is to protect the stomach lining and regulate blood platelets. So in this case, it is not inhibited. Okay, because we are now using Celebrex, which is a selective COX-2 inhibitor. So this selectivity is crucial because it helps minimize the risk of gastrointestinal issues such as ulcers and bleeding, which are common side effects of non-selective NSAIDs. So understanding this mechanism highlights why celecoxib is a preferred choice for many patients that need long-term NSAID therapy. So let's look at the differences of celecoxib from other non-selective NSAID. Okay, so unlike non-selective NSAID like ibuprofen and aspirin, which inhibits both COX-1 and COX-2 enzymes, celecoxib primarily targets COX-2. This selectivity results in fewer gastrointestinal side effects such as stomach ulcers, bleeding, making celecoxib a safer option for long-term use in patients at risk for developing gastrointestinal issues. So non-selective NSAID, while effective, can compromise the stomach's protecting line, leading to potential complications. Celecoxib's design aims to mitigate these risks, offering a tailored approach to inflammation and pain management. So the specificity not only enhances patient safety but also improves adherence to long-term treatment plans, which are crucial for chronic conditions. So let's look at the side effects of celecoxib. Okay. So some of the side effects of celecoxib include you may experience some stomach pain, but remember these are not some patient may experience the stomach pain and some may not experience stomach pain. And also we have diarrhea, indigestion, gas, you may just experience some gas, bloating and everything, swelling in hands or feet. And remember, this side effect that I've mentioned is not a must that if you take celecoxib you'll experience them. It's only available, and in rare circumstances some patients may experience them. But some more serious side effects include heart attack or stroke, kidney problems, severe allergic reaction. Remember that these serious side effects, they only occur to those patients who have some, maybe if you take celecoxib but you are not supposed to take it. Like if you have a heart condition and you have kidney problem, you have any kidney issue, you have any severe allergic, maybe you had some allergic reaction to other NSAID before. So these are serious side effects, they occur in such patients. It doesn't mean that they'll occur when you take it. So always monitor for these serious side effects and seek medical attention if they occur. It is important to balance the benefits of pain relief with the potential risk, especially for patients with existing health concerns. Regular checkups and open communication with your healthcare provider can help manage and mitigate these risks effectively. So this ensures that you can continue to benefit from celecoxib while minimizing the chance of adverse effects. So let's look at those people who are not supposed to use celecoxib. So let's look at those individuals who can use celecoxib comfortably. So it is prescribed for individuals with the following conditions. In other words, we are looking at the uses of celecoxib, or the conditions that celecoxib treats or manages. So it's used to treat individuals with the conditions such as osteoarthritis, rheumatoid arthritis, ankylosing, and it's called ankylosing spondylitis, acute pains, menstrual pain, and rather minimal. So your healthcare provider will determine if celecoxib is suitable for your specific condition. It is particularly beneficial for patients who require long-term NSAID therapy but are at risk of developing gastrointestinal issues from non-selective NSAID. So celecoxib's ability to manage inflammation and pain effectively while reducing the risk of stomach ulcers and bleeding makes it an ideal choice for these individuals. Always follow your healthcare provider's advice to ensure the best outcome for your treatment plan. So celecoxib is prohibited in the following people. Individuals with known allergies to sulfonamides, patients who have experienced asthma, allergies known as urticaria or allergic reactions after taking aspirin or other NSAIDs. Individuals with a history of gastrointestinal bleeding or ulcers, patients with severe liver or kidney disease, those with a history of heart disease or stroke without consulting a healthcare provider. And also in pregnant women, so especially in the third trimester, should avoid. So these pregnant women should avoid celecoxib due to potential harm to the fetus. It is crucial to provide a complete medical history to your healthcare provider to avoid any contraindications. So patients with this condition should discuss alternative pain management options with their healthcare provider to find a suitable and safer treatment plan. Advantages of celecoxib over other NSAIDs. So the primary advantage of celecoxib over non-selective NSAID is to lower risk of causing gastrointestinal problems. Just as we had discussed, it inhibits only COX-2. It is targeted to inhibit the dangerous COX-2, but it leaves the safer COX-1 which is responsible for producing protective to the stomach lining. So this makes it a preferred option for patients requiring long-term NSAID therapy, particularly those with a history of stomach issues. In addition, celecoxib's selectivity allows it to provide effective pain relief without compromising gastrointestinal safety, which is a significant concern with the traditional NSAID. So its targeted action not only improves patient comfort but also enhances adherence to treatment plans, making it a valuable option for managing chronic inflammatory conditions. So these benefits underscore the importance of celecoxib in pain management. So the doses and dosage forms of celecoxib. So celecoxib is available in several dosage forms, including 50 milligrams capsule, 100 milligram capsules, 200 milligram capsules, and 400 milligram capsules. So the usual recommended dose varies based on the condition being treated. For instance, osteoarthritis will need 200 milligram once daily or 100 milligrams twice daily. So the rheumatoid arthritis will need 100 to 200 milligrams twice daily. And remember that when I say twice daily, I mean after every 12 hours. So after every 12 hours. So acute pain, or it is also in acute pain or menstrual pain, initial dose of 400 milligrams followed by 200 milligrams if need be on the first day, and 200 milligrams twice daily as needed thereafter. Always follow your healthcare provider dosing instruction. Proper dosing ensures maximum efficacy while minimizing the risk of side effects. It is important to take celecoxib exactly as prescribed to manage your condition effectively and safely. So common brands that are available globally, we have Celebrex that is available in the USA, Onsenal which is available in the European Union, and also we have Consensi, which is but Consensi is a combination of celecoxib, another an antihypertensive medication known as amlodipine. Okay, so check with your local pharmacy for availability of this medication, of these brands. Okay, so understanding the different brands names can help ensure you receive the correct medication. The brands may vary in availability depending on your location, so it is essential to know the alternatives. Consulting with your pharmacist can also provide additional insights into the best options available in your region. Okay, so common precautions. Let's look at the common precautions while using these medications. Okay, so inform your doctor if any allergies or medical conditions appear or you may face it. Okay, avoid using other NSAID or aspirin concurrently with medical advice. Always don't use this when you are taking one NSAID. Don't use it with another NSAID together. Just use one at a particular time. So be aware of potential interaction with other medications, including blood thinners and certain antidepressants. Okay, so if you are on an antidepressant or blood thinners like warfarin, heparin, and those other blood thinners, please do not use celecoxib. So, and also regularly monitor blood pressure and kidney function, especially with long-term use. Okay, it is a selective COX-2 inhibitor. It can have some effects on kidney when you use it for a long time. So always monitor your blood pressure and also kidney function, because sometimes it may have some effects on the heart. That's why you should monitor blood pressure. Okay, so also limit alcohol consumption to reduce the risk of stomach bleeding. So just as I had mentioned earlier, always consult your healthcare provider for personal advice. Also follow these precautions. If you follow these precautions, you can help minimize the risk of side effects and ensure the safe and effective use of celecoxib. Staying informed and being vigilant about your medication can significantly contribute to better health outcomes. Okay, so thank you. That's a comprehensive look at celecoxib. I hope you found this information helpful. If you have any questions or topics you'd like us to cover in future videos, please leave a comment below. Don't forget to like this video and subscribe to MedEd for more valuable content. Stay informed and stay healthy. Bye bye.